So I'm Victoria. I'm a level 2 McMaster nursing student, and I'm going to be the nurse today with you to do a procedure. Before we get started on anything, I'm just going to make sure that I have the right patient. So could I get your name, please? And your date of birth as well. Perfect, thank you. And I'm also just checking your wristband here. So it's really nice to meet you, Mr. Mancini. Today, we will be doing a Foley catheter insertion as per order of the doctor. The bladder scan that we did this morning demonstrated that you did have about 630 milliliters of urine in your bladder. And the sensation that you've described to me earlier of having to urinate is also, they're both indicators that we would have to proceed with the procedure. Okay, so before we get started, all I'm going to do is I'm just going to palpate your bladder, so your lower abdomen, and I'm just feeling for any distension. So as I'm doing this, just please let me know if you're feeling any pain or discomfort at all. Perfect. So is there any pain? No? Okay, so it does feel a little bit distended, but it is a good sign that there is no pain at the moment. So before anything, I'm just going to put you in the dorsal recumbent position before we get started. Great, so now that you're in position, I will be right back. I'm just gonna go and collect my supplies. Okay, Mr. Mancini, so I've gathered my supplies here now. In a real life situation, I would drape my patient for privacy, but for today, this will do. And I do have a soaker pad underneath the patient. So next I'm just gonna be organizing my supplies. Okay, so now that we've just performed the peri-care on Mr. Mancini, I'm just going to be opening up my supplies. And I'm just discarding anything that I won't be using. I'm just opening up the catheter tray by only touching about 2.5 centimeters of the extremities of the borders. So now that it's open, I'm just using the forceps here, making sure that I'm not touching anything else. And I'm just going to be opening this up here. And I'm just touching the borders. And I'm just setting this right in front. And with this one here, I'm just draping. So now that my patient is draped, I'm just going to be opening up my catheter. And I'm just double checking that I have the right size, and I do. I have a size 12 as per the doctor's order. So now I'm just opening this up over my sterile field, making sure not to touch. I'm just going to discard that there. Okay, so now I'm just putting on my sterile gloves. And I'm just making sure not to go in from the inside on this hand. Okay, so now I'm able to touch everything because I have my gloves on. So next, I'm just going to be opening up the catheter. Discarding this here. And just using the syringe, I'm going to be testing the balloon to see that it's not broken. Okay, so now I'm just inserting the syringe onto the end of the catheter. And I'm just going to be blowing it up to see if the balloon inflates. Now, as we can see there, the balloon is inflating, so we have a functional catheter. So I'm just removing the liquid from it. I'm going to put my cap right back on there. Next, I'm going to be lubricating my catheter here just by inserting the head into this pouch of lubricating jelly. And I'm going to be lubricating right about 7.5 to 10 centimeters of it, as this is what will be inserted. Okay, now that it's lubricated, I'm just setting this in my tray. And now I have here my antiseptic solution with iodine. And I'm just opening this up and I'm going to be pouring it over these cotton balls here. And I'm just pouring enough so that it's nice and covered. And I'm just going to discard this here. Okay, so now that everything is nice and set up, I'm going to move my catheter tray over to the patient. Okay, so before I actually move it to my sterile field with the patient, I am just going to be attaching my syringe to the catheter. And this will just facilitate the process. Okay, so now I'll just be moving my tray. Okay, so now that I have my supplies here, with my non-dominant hand, I'm just going to be separating the labia majora to expose the urinary meatus. So this hand, I will not be using it because it's no longer sterile. But with my dominant hand, I'm just taking a cotton swab that's been soaked in the iodine to clean the area. And I'll just be in one motion, starting from the clitoris to the anus, and I'll just be starting distally for myself. And I'll just be discarding this. So again, distally, just in one swipe. All right, and just with the last cotton swab, I'm just going straight down the middle. Okay. Okay, so now that everything is sterile here, with my dominant hand, I'm just gonna grab the catheter. Remove it from the lubricant pack. And I'm holding it about 7 centimeters. And now I'm just inserting it into the ureter meatus until urine starts to come out. Okay, so urine is coming out, so now I'm just inserting it right about 2.5 centimeters more. Okay, so for this next step, now that it's been inserted with my non-dominant hand, I'm just going to hold the catheter in place. Okay, so now that I'm still holding it in place, and that we've pre-attached the syringe, and the syringe has 10 milliliters of water, so that's what we'll be inserting. I'm just going to be inflating the balloon. Okay, so now the 10 milliliters has been inserted. I'm just removing it, the syringe, and I'm just going to give it a little pull. And the catheter is well in place. Okay, so now the catheter is secure and inserted, I'm just going to be attaching here the drainage bag. Perfect, and now that's secure. Okay, so in a real life scenario, I would secure the catheter to the patient's leg, but I won't be doing that in this case. And I'll just be discarding the rest of my supplies. Okay. Okay, Mr. Mancini. Was there any pain at all or discomfort? No? Okay, well, you let me know if there's anything that I can do for you, and if there's any pain or discomfort that arises, don't hesitate to let me know. Okay, Mr. Mancini. Since your urine output has been greater than 30 milliliters per the hour, the doctor has ordered the removal of the catheter. Okay, so my first step is I'm just noting how much urine you have. You have about 400 cc output, and it is clear and yellows. So everything appears normal. I'm just putting gloves on, and I have an empty syringe here, should deflate the balloon. So I'm going to leave this attached just in case anything else comes out during the procedure. But now all I will be doing is that I'm attaching the syringe and I'm removing it. Okay, perfect. And about exactly 10 milliliters of the water came out. So now it should just pull out easily. Perfect. And now I'm just going to discard this. Okay, so now that it's all done, my next step would to wash my hands with soap and water. And I would use this method opposed to sanitizer just because I was working with some bodily fluids, so you would want to make sure that that's your hands are properly washed. So my next step would just be to document all this. So I'm just going to take you over to my nursing station. Before I touch anything, I am going to sanitize since I've already washed my hands. So now here I am just documenting my patient's urinary output along with the color. And like I stated it was yellow and clear. Now I would also document here any signs or symptoms that I saw with the patient. And I took their vital signs, everything appeared normal. He didn't mention any pain or discomfort, and he is ambulating properly. And I also just documenting the procedure.